Hi, this is Dr. Carmen Fong, and welcome back to Gut Feeling. The gut-stress connection is way more serious than you think. This is how people end up in my office. So generally people will come in and be like, I don't know what happened, but like something happened about 6 weeks ago and suddenly everything hurts and I can't eat, I'm having diarrhea or I'm having constipation. So what we really know now is that there's something called the gut-brain axis, which is kind of awesome. And so basically there's a feedback loop that your brain tells your gut what to do, but your gut also tells your brain what to do. That's the simplified version. So one of my favorite examples though is when people say that, you're feeling butterflies, and feeling butterflies in your stomach or in your abdomen, I like to use the medical terminology, is actually a sign that you're feeling anxious or you're feeling anxiety. And so your body's telling your brain that something isn't right, and that's why, it's kind of why, part of the reason why I call this podcast Trust Your Gut Feeling, because your gut really is telling you what you need to do. I'm a Pisces, and so most of the time I actually think that I am pretty good at trusting my instincts. I'm going to now be able to say thank you to my microbiome. Why does stress, cause constipation and diarrhea? There's actually a couple of reasons. We know that stress causes an inflammatory response, which increases the cortisol levels in your body, right? And so again, when your cortisol levels are increased, you have an increased fight or flight response. And so instead of direct blood flow to your gut where you can rest and digest, you're actually directing your blood flow to your muscles where you're like, run away from that lion and get to safety. And so when you're not digesting, you're going to have constipation, you're going to have more diarrhea, things are sitting there for too long or not long enough, changing the consistency of your stool. And that's the first reason. The second reason, we know that generally can be because of other hormones, not just the cortisol. And so other hormones at different times of the month might also change the way that your body is digesting foods. And so for a lot of people, especially, women who will come in and say, hey, yeah, around my time of month, I feel like I have more constipation, I have more diarrhea, and that is because of fluctuating estrogen and progesterone levels. So it's not in your head, it's true. If anybody tries to tell you that it's in your head and, ignore it, tell them there is a scientific basis for this and go find someone else who will take care of you. One of my favorite topics is why high performers or high achievers, which I know is all of you because you're all watching this, why we ignore these signals. And it's pretty easy, right? So we feel like there's more important things in our lives and we're going to, go all the time. And the more we can do, the more we can achieve. And the more we can achieve, the more successful we'll be. And we're completely ignoring our body and we're completely ignoring our gut feelings. And I would say that, when we're ignoring our gut and we're ignoring our body signals, sometimes we forget the urge to poop, we forget the urge to pee, and, holding all of these things in can have somewhat toxic upstream effects, inside our bodies, but can also cause things like hemorrhoids, anal fissures, and anal fistulas. So when you're working really hard throughout the day, I would just say kind of no matter what, take care of yourself first because your body is your temple and you are the most important thing. And if you don't take care of yourself, you can't take care of anybody else either. So until next time, remember that gut health is butt health and trust your gut feeling.